Well, thanks, Brad, for giving an overview of the waiver services with Bryn and with Manna. I think that's going to be very helpful to a lot of advocates and families. One of the areas that we know is that these services are still relatively new. I mean, they've been around for a while, but as far as we go back 20 plus years, we know that there was no waiver services, and that there was no family support program. It had waiting lists. It was difficult for families to navigate. You had to know about it. And we're getting to a better situation for a lot of families right now. But one of the things that did exist 20 years ago and even longer was the HealthCheck program. And we're seeing this as a very important opportunity for advocates and for families, and most importantly for the children and young adults that are eligible for these services. HealthCheck is a very important program that's available through the state of Wisconsin. It's called EPSDT at the federal level, as you know. But it's a program that provides a lot of important services: screening, diagnosis, treatment, and those elements are very important. And that's kind of what the waiver. So you have this collision sometimes between the waiver resources and HealthCheck other services, and thinking like, well, the waiver doesn't want to pay for card services, and the card services don't want to pay for aren't going to pay for some of the waiver services. So that's where you really have to identify some areas for families, and making sure that we have a good delineation between the two types of programs. The takeaway is that HealthCheck other services, which is beyond what the state Medicaid program provides, is to pay for medically necessary services that are required for the child.
And that are medical in nature.
Right. Where the waiver services are kind of outside that scope.
Right.
One of the areas that we're excited about looking at is we think about the HealthCheck and HealthCheck other services, but sort of baked into HealthCheck, there's services of administrative, or they call it Wisconsin, access case management. And then if it's identified as medically necessary, arguably families should be eligible for more in-depth case management. We're working with the state of Wisconsin trying to open those pathways up because, for example, we know that one of the most difficult things to pay for in a medical home environment is a lot of the benefits for service coordination. And yet within HealthCheck, some of those benefits are already baked in. So it's an exciting time for the world that we work in. It's much better than it was 20 years ago when we started, and 30 years ago when I started. But it's getting better, and I think we're always looking towards process improvement, opportunities to help more families, and thinking about how do we push those boundaries farther for services and things of that nature.